Welcome back to Fluvoxamine Frontiers, Battling COVID 19, where we are uncovering new dimensions of fluvoxamine's role in the pandemic. I'm your host, Dr. Soma Rohatgi, joined by our guest, Saakshi Sharma. Today we are exploring a new frontier, fluvoxamine's potential in pediatric and adolescent patients with COVID 19, a group often overlooked in treatment discussions. Imagine young patients as delicate plants in a garden, vulnerable to the harsh winds of COVID 19. Fluvoxamine might act like a gentle gardener nurturing these plants back to health while ensuring their safety. But how does a drug used for adult mental health conditions fit into this delicate context? Let's find out. Sakshi, let's start with the evidence. What studies or data support fluvoxamine's use in pediatric or adolescent COVID 19 patients?
Yes, Dr. Soma, this is an exciting area with emerging data. While fluvoxamine's use in children for COVID-19 is still in early stages, a 2022 study in Brazil involving adolescents aged 12 to 17 showed promising results. This outpatient trial found that fluvoxamine at adjusted doses reduced symptom severity in high-risk teens, like those with asthma, with no hospitalization in the treatment group. Another small study from South Africa in 2023 reported similar findings, noting that adolescents with mild COVID-19 recovered faster with fluvoxamine compared to standard care. These studies leverage fluvoxamine's established safety in pediatric psychiatry, where it's used for OCD, suggesting it could be a safe option to prevent severe outcomes in young COVID-19 patients.
That's really encouraging, Sakshi, helping kids weather the storm safely. Now, how do the dosing and safety considerations differ for younger patients compared to adults when using fluvoxamine for COVID 19?
Dr. Soma, dosing in kids is a delicate balance. In adults, fluvoxamine is often given at 100 milligrams twice daily for COVID-19, but for children and as adolescents, doses are lower, let's say typically 25 to 50 milligrams daily, as seen in the Brazil study, adjusted for the body weight. This accounts for differences in metabolism as kids process drugs faster. Safety is critical. Fluvoxamine's side effects, such as nausea or drowsiness, can be more pronounced in younger patients, so clinicians start low and monitor closely. A 2022 Canadian pediatric study emphasized gradual dosing to minimize dizziness in teens. Drug interactions are also a concern, as fluvoxamine affects liver enzymes, requiring careful review of other medications. The goal is efficacy without overwhelming young systems.
So, it's about tending to those young plants with extra care. Now, what are the ethical challenges of using fluvoxamine in children for COVID 19 given its off label status?
I would say the ethics here are complex. Using fluvoxamine off-label for COVID-19 in kids raises concerns about informed consent, as parents and teens need clear information about limited pediatric data versus potential benefits. A 2023 ethics review in pediatric journals highlighted the challenge of balancing risk, mild side effects versus severe COVID-19 outcomes. Another issue is equity. Trials like the South African one showed access disparities, with rural kids less likely to receive fluvoxamine. There's also the stigma of using a psychiatric drug in children, which can worry families. Researchers address this with transparent communication and rigorous monitoring, but more pediatric specific studies are needed to build trust and ensure ethical use.
You are correct. This Careful approach is so important for our youngest patients. Fluvoxamine is a careful gardener tending to the delicate roots of young patients, fostering recovery from COVID 19 while protecting their growth. With gentle dosing and ethical care, it nurtures hope for kids facing the pandemic's winds. Thank you, Saakshi, for exploring this vital frontier. Listeners, keep discovering with us on Fluvoxamine Frontiers. Till then, remember, science is full of possibilities waiting to bloom.